Hello, welcome to the Jacksonville Urban League Entrepreneurial Center's Health and Wellness in the Workplace. I am Jocelyn Turner, so pleased to be with you today. As you know, the past 20 months in the world has been like none other that any of us have ever experienced. Yes, I'm talking about the pandemic and the coronavirus, also known as COVID-19. I am pleased to be working with the Jacksonville Urban League on a very important initiative here in our community. Unfortunately, there's a lot of myths out in the community in regards to people not really understanding what the virus is, not really understanding what the vaccine is, and the impact that it has on each of us. So I am pleased to be working with a project, a federally funded HRSA grant with the Partnership for Child Health, where we are going out in the community talking to businesses, thanks to our partnership with the Jacksonville Urban League, working with physicians, as well as talking to the community, answering questions that they may have about COVID, hopefully helping them to be better informed as they make decisions to get vaccinated. Again, I am Jocelyn Turner. I am going to be going through a series of modules today, and you can follow up with the Jacksonville Urban League if you have any questions. Let's get started. The success of your business depends on your health, wellness, and COVID-19 response. And as we all know, there's been unfortunately, a lot of politicizing when it comes to the virus. A lot of businesses were impacted during the pandemic, and some are still trying to recover and recoup. But by being better informed from this presentation, you will help yourself, your family, your customers to make sure that your business is healthy and progressive. The world is changing. It's our responsibility to adapt. By championing policies and practices that promote health and safety, you can mitigate risk and secure a better and more stable future for your company. Isn't that what it's all about? We will cover health promotion and preventive strategies in the following fields and explain how they benefit your company. The areas that we're going to talk about are mental health, physical health and fitness, nutrition and healthy eating, and of course, staying protected against COVID-19. Our agenda again will include mental health and wellness, physical health and wellness, nutrition and healthy eating, staying protected from COVID-19, how well do you know health in the workplace? And we're going to end with a COVID-19 true or false. Sorry for the error on that slide. Let's start with module 1, mental health. Now, when we think of mental health, a lot of people, unfortunately, have a hard time understanding why it is important to talk about mental health and recognizing it in our loved ones and friends. So from today's discussion, hopefully you will be enlightened and therefore able to recognize it if there are any issues in your own employees. 46% of workers report struggling with mental health issues. People come to work every day having left who knows what issues at home. Maybe they got up that morning, the car wouldn't start, had every good intention to get out. They had a sick child, worried about their elderly parent. Whatever the case may be, we do have to recognize that workers are struggling with all sorts of mental health issues. And the fact that we are aware of that, it helps us then to better prepare ourselves and know how to respond and know when it's time to refer our employees to seek assistance. A stressed worker does not equal a productive worker. Employees should be feeling well, having a positive outlook, easily adapting to changing circumstances, tolerating reasonable amount of pressure, and enjoying rewarding personal relationships. And we do develop relationships with our colleagues because we spend so many hours with one another. So again, if an employee has all of these, then they will be a less stressed worker and therefore a more productive worker. It's all about balance. Most common mental health illnesses in the workplace: depression. You may notice that your employee, who normally has a bubbly personality, is snapping at the customers, snapping at you, seems to be preoccupied. That may be an indication that that person is depressed. Anxiety disorders. All of us, many of us, have probably experienced anxiety through this pandemic. Of course, we have to recognize that and know when it's time to get help. Work-related stress. Again, so many businesses, unfortunately, may have lost a lot of revenue. Businesses anticipate what they want to earn or what their forecast is for earnings in the year. And with the pandemic, that changed. So you can only imagine how much stress was not only on yourselves, but your employees, because maybe you had to cut back on hours. Maybe they were out of work for several months. And now you may have the added pressure or stress of bringing those employees back into the workplace because people were just overwhelmed and not able to cope. Anxiety. Panic attacks are discrete episodes with an abrupt beginning and specific end. Some symptoms might include rapid heart rate, feelings of impending doom, feelings of being out of control, abdominal cramping. And a lot of people may not have ever had these experiences or ever experienced anxiety prior to the pandemic, because it is something that none of us have ever experienced in our lifetime. If you develop these symptoms, call your doctor or visit cdc.gov/coronavirus. Overlapping symptoms: chills, shaking, sweating, chest pain, hot flashes, shortness of breath. Symptoms: COVID-19, of course, fever, dry cough, trouble breathing, extreme fatigue. When in doubt, of course, call your doctor. If you do not have a doctor, then make sure you reach out to the Florida Department of Health. Someone there will definitely be able to help you. Mental health problems commonly manifest as physical symptoms. The relationship between an employee's well-being and the quality of work environment are dependent on one another. Absenteeism. If you've noticed that an employee who never missed a day of work are suddenly calling in sick, saying that they can't come in. Maybe they're even saying they're having car issues or babysitting issues. But this is an employee who not had any absences or rarely took off. Decreased productivity. Again, a person who had a very bubbly personality, but all of a sudden seemed to be slumping and slacking. Increased cost to the business. When an employee or when the workforce is not producing as they should, then of course, the cost to business happens in so many ways. Sometimes the cost is financial. The cost might be losing customers because they notice that your employees are not as productive as they are, or the business is not as thriving as it has been. And of course, those indirect costs. Don't hesitate to get help. Individual and family counseling is important. It is important to you as a business owner to not only recognize when your employees are stressed, but recognize when you may need to seek counseling, and don't be ashamed of it. There is treatment available for depression, anxiety, and other life issues. And let's face it, a pandemic is certainly an opportunity for any of us to seek counseling if we never have before. Also, unfortunately, some of us are coping with having lost a loved one during the pandemic. Almost 800,000 Americans lost their life to that pandemic. Let's think about that a moment. Most of us probably know at least one person who have either had COVID-19 or unfortunately who died of complications of COVID-19. That's very stressful. Psychiatric medication management may be necessary. Again, don't be ashamed to seek help, not only for yourself, but also recognize it for your employees. And mental health first aid is available in our community through Baptist Health, for instance. Just if you Google mental health first aid, you will find that offering available for you, your employees, your family members, because the key to managing our own mental health is to recognize that we are having an issue. And the Duval County, or the Florida Department of Health rather, is also an option, as you see on the screen. That concludes part 1 of our series on mental health.